So say a patient comes in and she's like,
my nose is so stuffy and I have a headache and I just feel really congested. Do you recommend Zyrtec D or do you recommend Claritin D?
you cannot answer that as a pharmacy technician. Hello everybody, welcome back to my channel. It's me, Maya K. Today I'll be answering all the questions that were commented below on my last pharmacy technician video. If you have not seen it, it is right here and it is down below in the description box. Go ahead and check that out. So today I'll just be answering some questions that were commented and the questions that were DM'd to me on Instagram. I answered some of them directly to that person, but the others I just wrote down right here so that everybody can see and everybody can hear my answers to these questions. So I'll just jump right into it. The first question is, what is a pharmacy technician? I'm pretty sure everybody watching this video knows what a pharmacy tech is, but just in case you don't, it is basically playing the role as the assistant to the pharmacist. So basically, just as doctors have nurses to help them, you'll be helping the pharmacist. You'll be preparing and dispensing drugs on a daily basis and just getting the prescription ready for the patients. So what is a typical workday in the pharmacy? A typical workday in the pharmacy involves product dispensing, data entry, releasing it to the patient, returning to stock. So all those different things, I can address it what those things are. Product dispensing is when you're counting the prescription, you're getting it ready for the pharmacist to check it, and then he gives it to the patient. Data entry is, say if the patient brings in a prescription, hands it to you, you would type in that prescription and then the pharmacist will check it, and then after he or she checks it, they will send it back to you. You'll prepare it and get it ready and count it out and everything, and then you send it back to the pharmacist and he or she will check it again, and then that's when it gets dispensed to the patient. Release to patient is basically just giving the patient their prescription. Sometimes there's counseling and the pharmacist can do that. Only the pharmacist can do counseling. Pharmacy technicians cannot do counseling, and pharmacy technicians can also not do recommendations. By recommendations, I mean, say if a patient comes in and she's like,
my nose is so stuffy and I have a headache and I just feel really congested. Do you recommend Zyrtec D or do you recommend Claritin D?
You cannot answer that as a pharmacy technician. The pharmacist has to answer that question. So in that instance, you would just get the pharmacist and say, oh, okay, that's a question for the pharmacist. I'll grab him or her and they'll come and recommend which one you should take. Okay, so the next question is, what is pharmacy school and is it the same thing as a pharmacy tech training program? So pharmacy school is when you want to go to school to be a pharmacist. It is not the same thing as pharmacy technician school or pharmacy technician training. So basically, pharmacy school is if you want to be a pharmacist, and pharmacy technician program or schooling is if you want to be a pharmacy technician. Typically, pharmacy school is 4 years, but pharmacy tech programs can range in time between like 6 months, 12 months, or 24 months. And my program was a year, so my program was 12 months. Okay, and out of that program, I got my state license. Now for my PTCB license, I did that separately. So, but that is the next question. Let me get into that. What is the PTCB and do I need it to become a pharmacy tech? So basically, you don't need it to become a pharmacy tech. The PTCB just gives you your national certification, so it would give you the ability to work anywhere you want to work versus your state license where you can only work within that state that you got your certification in. So say if I live in Texas and I want to move to California and I want to be a pharmacy technician, since you got your state license in Texas, you can't go to California and practice as a pharmacy tech. But if you had your PTCB license, you would be able to go anywhere you want to go and still be a pharmacy technician because you have your national license, which means you could work anywhere in the nation, okay? So that's the difference between the PTCB and regular state license. State license, you can practice in that state. PTCB, you can practice anywhere you want to practice. Someone asked about the top 200 drugs on the PTCB exam. It is important for you to know your top 200 drugs. These are the top 200 drugs. They're the most popular drugs in the pharmacy that are being dispensed to patients. So it is important to know these drugs. You're not going to know every single drug in the pharmacy, but the top 200 drugs, they are very important. And for me, I learned them was through flashcards. Flashcards were very important for me, and they still are important to me. I still have my flashcards, and I've kept them. Flashcards are very important, and they are very essential in pharmacy world. To me, they are, because flashcards really help me a lot. It's easy if you just take like 10 a day. It's so loud. If you take like 10 a day or 15 a day, it will become easier and easier for you to remember them and become familiar with them and what they're used for. So they are important, and as time goes on in the pharmacy, it's gonna be like, I know what this is because I work with it so much. So don't be nervous about the top 200 drugs. It may seem like a lot, but it is really not a lot, and you will become familiar with it very quickly. So flashcards, and then plus the hands-on work in the pharmacy. When you actually get in there and you're working with these prescriptions every day, it will be easier, and it will be easy to keep it in your brain and remember each drug. How long does it take to become comfortable in the pharmacy? For me, it was very quick. The first 2 weeks, I was with someone who was actually by my side. Everything that I did, I had somebody with me. I guess it would depend on your training. Whichever job you choose and the training that they give you, I think that would have the outcome to how quickly you become comfortable. Like I said, I had somebody working with me for the first 2 weeks. They helped me with a lot in the beginning. So I think everybody should get that same treatment in the beginning. They're not just gonna leave you alone and say,
we're just gonna throw you out there and let's see what you can do as a pharmacy tech.
No, they're gonna train you, and they're gonna be with you, and they're gonna help you so that you do feel comfortable by yourself, because they're not just gonna put somebody by themselves right off the bat, because they wanna make sure that you're doing what's right for the patient. And by doing what's right for the patient is making sure that their pharmacy techs know what they're doing, and they're not going to leave you alone if you don't know what you're doing. What happens if I make a mistake in the pharmacy? So I was worried about this too when I first became a pharmacy tech. Like, what if I make a mistake? And I think that is something that everybody worries about. If you do make a mistake, just know that it will always, always, always go to the pharmacist. The pharmacist checks every single thing that the technician does. So say if I'm on data entry and I choose the wrong drug, or I choose the wrong dosage on the drug, the pharmacist will see that, and he or she will send it back like, hey, you picked the wrong one. Just wanted to let you know. I took a note of it. Just wanted to let you know so that you can fix it and you can learn from it and you can move on. Just take your time. And I caught the mistake and it didn't reach the patients. I would just say take your time and try your best to make sure you don't make mistakes. But we are human and we make mistakes all the time, even at work. So if you do make a mistake, the pharmacist will see it, because like I said earlier, the pharmacist checks everything that pharmacy technicians do. So the pharmacist will see that, he or she will correct you, and that is how it will be fixed before it ever reaches the patient. Okay? Do I like being a pharmacy technician? I love being a pharmacy technician. It makes me happy to know that what I'm doing as a pharmacy technician helps somebody in their daily life. Some of these patients have anxiety or depression, or they may have diabetes, may be in pain, whatever it is. I know that what I'm doing by preparing and dispensing these drugs, that the patient is being benefited by what I'm doing. So that makes me happy to know that, hey, I play a role in somebody being happy today, or somebody not feeling that pain today because they took the prescription that I prepared for them. So that makes me happy to know that I may have made a difference in somebody's day. For me, I'm a people person and I like helping people. So I always wanted to work in the healthcare field, and I knew that, being a pharmacy tech, I could help people. So that's what I did, and I'm happy about that. And I'm happy that I am a pharmacy technician. I hope that each day that I can continue to help patients and make them feel better by everything that I do. This is a very popular question. It is, how much do you make as a pharmacy tech? So pay is based off of where you live. So some people may make more and some people may make less. Pay is also determined by your experience. Say if you have no experience, you may make less than somebody who has 5 years of experience. I can't give specific numbers because I simply just don't know. But there's a website called ZipRecruiter, and I linked it down below in the description box. If you click onto that and you scroll down to your state, it'll tell you like the range what you should be making as a pharmacy tech, and seems pretty accurate based off of what I've seen on the website. So check that website out if you're curious on how much you would make as a pharmacy tech. Also, if you have like a specific place where you want to work, I would say type in average salary for pharmacy technician in Detroit, Michigan at Walgreens, or wherever you plan on working at. You could just type that in and just see what the average salary is for that position at that store, because it varies a lot, and I can't give a specific number. I wish I could, but I can't. So try ZipRecruiter because they have exact numbers on that website. How do you get hired as a tech? So I would say, like I just mentioned, go online, type in full-time, part-time pharmacy tech positions, whatever position you're looking for, type that in and click on whatever you see available and apply. Just apply. Even if you don't meet all the qualifications or you don't have everything that their qualifications may say, still apply, because you never know. Also, if you know a specific place you want to work at, say you want to work at Rite Aid, you would go to Rite Aid's website and apply. Now me, if I'm gonna apply for a job, I'm gonna call them a couple of days later, because you don't know how many people are applying to that job and how many applications they have to go through. I'm gonna call them, I'm gonna say,
Hi, this is Maya, just calling to check and see what the status of my application is. I'm really interested in working in the pharmacy, and I just wanted to call you guys and just see what was going on with my application and what's the status of everything, because I'm very eager to work, and I'm very eager to work in your pharmacy.
and if they don't call you back, then you go to the next application and you move on until somebody gives you a job, because somebody will give you a chance. If you keep trying, somebody will give you a chance. The last question is, do you want to be a pharmacist? I don't want to be a pharmacist, and that's just me. I'm not here to encourage or discourage anybody from going into that field. It's just not the job that I want to have as my career. I plan on going into nursing and being a nurse practitioner. So that is what my plan is and what my goal is. Once I graduate and everything, that's the field that I want to go into. But I'm not saying pharmacy is not a good field, because it's a great field if you want to do that. But for me, this was a job where I use it as a learning experience, and I use being a pharmacy technician. I use being a pharmacy technician as a learning experience for my next career goal, which is a nurse practitioner. I feel like I've learned a lot about their medications, a lot about what they do for patients, a lot about how they help patients, and I feel like I can really apply that to my career in the future as a nurse practitioner. So I'm happy with my job as a tech, but I do not want to be a pharmacist, and that's okay. You don't have to go into pharmacy wanting to be a pharmacist. You can go in as a learning experience like I did. So that's it for the questions. Now, if you made it to the end, you get to hear a few tips from me. It's not a lot, it's just a couple tips. If you're a beginner pharmacy tech, I would say bring a notebook with you. I suggested this to somebody when I first began. I had a little notebook, like a little pocket notebook, and I kept it with me at all times. And every time I learned something new from a tech when I was being trained, I would write it down so that I would remember it and keep it. Fortunately, I don't have that notebook anymore, but it was filled with stuff so that whenever I had a question, I didn't have to go and ask somebody. I could just look at it and it was right there. Now, that goes into my next tip. Don't be afraid to ask questions. For me, I wrote everything down so I didn't have to ask. But do not be afraid to ask questions in the pharmacy, because if you don't ask questions and you don't know, then you can't help the patients. And if you can't help the patients, then that's just not good. So ask questions, ask questions, ask questions. Trust me, they want you to ask questions. They don't want you to be lost and dumbfounded, like, I don't know what to do. Ask questions, okay? It's so important. You want to know everything you can know. You want to be as knowledgeable as you can be in the pharmacy. So ask questions, ask pharmacists questions, ask the other techs questions, ask the interns questions. Always ask questions, because you can never be too knowledgeable, and you can always learn something new in the pharmacy. Okay? And my last tip is to always have patience. It is a fast-paced environment in the pharmacy. It takes just a little bit to get adjusted, but if you're patient with yourself and with the patients, then everything will be fine, okay? Some patients come in and they're upset about something else, and they may take it out on you, but you can't, let that affect you. You just have to continue to be professional. It's easy to get stressed out, but you have to just have patience. Like, okay, I'm working, I'm helping somebody, I'm doing this because I want to help patients, and I want to make patients feel good and feel better. So that's my advice. To bring your notebook when you first begin. Have a little notebook and keep that notebook. Don't lose it like me. Keep your notes, guys, because it will really help you if you ever need to go back and look at something. If you're confused or if you're lost, it will always help you. Okay, so notebook is the first tip. Ask questions at all times. Never be afraid to ask questions. And have patience, okay? Have patience with the customers, have patience with the environment, with your coworkers, and with yourself. You can't be your best unless you are USA, okay? So this is the pharmacy Q&A. If I didn't answer anything, or if you have other questions that you may want to ask me, just comment down below or DM me. Thank you so much for watching this video. Thank you for your support on my last video about pharmacy. I really do appreciate it so much. If you have any other questions, or if you just simply want to talk about pharmacy or anything at all, you can do that down below, or you can DM me on Instagram. It's Maya K, and I will see you in my next video. Bye.